Good morning. My name is Jane McPherson, and I am really delighted and honored to be with all of you here today from my home office. I hope that you are enjoying your conference, and I wish you a wonderful time together virtually, if not in person. And I hope that these next few days are a time for great exploration and moving forward in our profession. And I am really excited to share my ideas as part of your conference. So now I'm going to stop my video and I'm going to share my screen, and I hope share some ideas that will be of interest to you. So again, good morning. I've been asked to address you this morning on the topic of really dealing with COVID. Who is social work and who are we ethically? What are we doing and how are we practicing in the time of COVID-19? And I am basing this talk on an article of this title that I wrote for the Journal of Human Rights and Social Work. I believe that we have an opportunity now to really embrace a rights-based approach to practice. So I was inspired by an article written by Arundhati Roy, who's an Indian human rights activist and writer, called "The Pandemic is a Portal." She wrote, "Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it." So I felt inspired by that. I thought, what can social work do? What is the opportunity for us when we are witnessing the impact of injustice and inequality that have been so baked into this pandemic? So I'm feeling, of course, human rights is the soul of my own work, and I feel like this gives us an opportunity to reassert our identity as a human rights profession and to take a human rights-based approach to our work with individuals and communities. I'm thinking that we can move beyond. We can move beyond this sort of traditional double mandate idea of the social worker needing to think about our service user or our client and our state or employee, and how do we negotiate those relationships into this. This is Sylvia Staub-Bernasconi's view, and I really like it, to think that actually social work has a triple mandate, that of course we need to be thinking about our client and our employer or the state, but really we are also required to think about our social work ethics, human rights, and the scientific knowledge. We have a professional mandate. And what is that? Well, this, pulling from one place we can find it, which is the global definition of our social work profession, we're told that principles of social justice, human rights, collective responsibility, and respect for diversity should be central to our work. I think that's really important. I think that it's easy to say those things, and it's more challenging to do it. One of the techniques of a human rights-based approach of practice actually is reflection, self-reflection, looking at our work critically. Are we truly respecting diversity? Are we truly respecting human rights? So more on that as we go along. So what are human rights? For the purpose of my work, I really think about the Universal Declaration of Human Rights, which was put forward by the United Nations in 1948, and is really it sets out all of our rights, which then have been detailed into many treaties and discovered more deeply. But I was very moved by this document when I first read it. I was a social worker. There's a picture of me and my fellow social workers in rural North Florida more than 10 years ago now. And I read this Universal Declaration as part of my own work. I was trying to help two women who had been previously trafficked. And I started to collaborate with a lawyer to try to help them figure out what to do. And he asked me if I'd ever read the Universal Declaration, and I had not. And that's common in the United States because it's not usually a part of our basic education. But when I read it, it changed my life. The idea of economic, social, and cultural rights was absolutely astonishing and renovating and inspiring for me. The idea that there is a right to work and to protection, that there is a right to standard of living, a decent standard of living, right? With food and clothing, housing and medical care, that these aren't just, it's not about needs, it's really about rights. Anyway, at that point, I stopped my social work practice and went back to school to get my PhD so I could really think systematically about what effect could human rights have on social work practice, and how could an infusion of human rights into our way of thinking renovate and improve our practice and really help us hold more tight to our ethics. So there is a right to non-discrimination. So that to me is also really critical. And then I like to point out that that includes property. That is to say, we shouldn't be discriminating against people who happen to live in poverty. They should not receive different quality of services than more propertied people. Certainly in my country, that isn't true, right? People who live in poverty generally receive fewer and services often of less quality. So, as we think about this lecture and we think about COVID, I think the pandemic has really shown unequal treatment. And as we think about human rights, we also have to think about our efforts at inclusion of all members of society, right? People living in poverty, young people, disabilities, internally displaced people, peoples with informal communities, migrants, people from all kinds of minorities, rural areas, other HIV and stigmatized illnesses. So as you listen to this lecture, please hold these people in both your heart and your mind. Who is marginalized in your own society, and how have they become further marginalized during COVID? So the difference between needs and rights, again, is central. I like this definition. A need not fulfilled leads to dissatisfaction, right? I'm hungry, so now I'm hungry. But a right that's not respected is a violation, and redress or reparation are required. More on this sort of needs-based versus rights-based approach. In a needs-based approach, we tend to see people in need as victims or charity cases. They may be understood as less than, which is of course discriminatory, and professionals decide who deserves assistance and how problems should be solved. Problems can be solved with simple aid, and aid is really about charity, not justice. From a rights-based perspective, people in need are rights holders who lack access to their human rights. People in need are not stigmatized, right? And all people deserve to have access to their rights. It's not about us choosing among who's deserving, right? Aid helps with immediate concerns, but it doesn't solve underlying problems of poverty and under-resourced communities and discrimination. That requires structural change and political action. Individuals, communities, and professionals are partners in solving problems, right? People are understood to be experts in their own lives. And aid is about justice, not charity. So I had the list when I first discovered the list of human rights, but I really thought, I'm a social worker, right? Social worker is about practice. So how do I translate this list of rights into a guide for practice? Turns out I'm not the only one thinking about that. Certainly as I began to delve into that, I found UN models and, other approaches, but I will share some of that right now. So the critical piece for turning the rights-based, for human rights into practice are these principles for rights-based practice: participation, non-discrimination, accountability, human dignity, and transparency. So dignity and worth of each person should be respected. People are rights holders. They have self-determination, right? And as social workers, we have to combat dehumanization, right? People are not objects. Each of us has dignity. I like this quote: "The discourse of rights is a discourse of human agents claiming what's theirs instead of asking permission from the powerful. Dignity, not charity, is the animating principle. People earn access to the rudiments of life by virtue of their humanity." Right. Non-discrimination, I also like to think of it as anti-discrimination, meaning that we really have to fight against any discrimination we see. So we're going to prevent discrimination on any basis, right? We're going to know that our understanding, our own vision is continually evolving. Many of us have privilege, right? Based possibly on our education or our social status. Privilege is really a form of blindness. We may not see how other people don't experience that privilege. We have to challenge ourselves. We have to make sure that our policies and programs are inclusive, right? And we have to move against hierarchy. We really have to have more equality in our relationships. Participation, is really understood now to be a fundamental human right. People need to be able to have voice in all decisions that involve them. A slogan from the disabilities movement is particularly beautiful, I think: "Nothing about us without us." Transparency. Transparency is about anti-corruption. And it's also about assessment, whose rights are being violated. It's about reflection, as I say, right? It's the understanding that there may well be violations that we're not seeing, what sometimes are called microaggressions, right? Human rights begin in small places close to home. Unless they have meaning there, they have little meaning anywhere. And accountability. Right? Here's where we're going to be promoting justice. This kind of moves us, as I will say more about, but really we have to operate in the micro, at the individual level, and at the macro, right? We have to change our society to make it more just. So to sum up, to promote and respect human rights, social workers have to learn and become aware of human rights, even if they're a larger group of rights than individuals may possess by law. Right? In my own country, the United States doesn't acknowledge social rights like the right to housing or healthcare, but that doesn't mean those rights don't exist. Right? We have to create programs and policies that follow human rights principles, and we have to lead and practice in a manner that does not violate, respects, and promotes human rights. So this is my definition of a rights-based approach to social work practice, that this is practice that sees the world through a human rights lens, is accomplished based on human rights methods, and aims towards human rights goals. And this is my model. You can see that has many pieces, and some of you who are familiar with my measurement work that I will discuss a little bit later. These are formats for measures. The human rights scales and then the human rights methods scales. So the lens, let's talk about the lens. Through the lens, we see service users or clients as people who are vulnerable and maybe experiencing human rights violations, and we see social problems as rights violations. A rights-based approach to assessment allows us to see the havoc wrought by the novel coronavirus through a rights-based lens and focuses on the impact of discrimination and other rights violations. We can see clearly how the virus is disproportionate in its impact, how it thrives, where racism, ageism, ableism, and other forms of discrimination thrive, and how it prefers those who live on the economic edge, who lack the space in which to self-isolate, who live with diseases exacerbated by stress and poor nutrition, and whose work does not easily translate online. Certainly, it also particularly menaces migrants and refugees, the homeless, the imprisoned, and the detained. When we're trained to see through this human rights lens, to understand individual problems as social, political, and structural, then it's obvious that we have to intervene more effectively in ways that both aid in the moment and also improve the lives of families and communities over time. I think this was one of my own, real kind of aha moments when I discovered human rights, was to think about when I worked at the health department, how I had many families who were living with hunger, and I could provide them an occasional meal or a pass to a food bank or a pantry. But that didn't solve their problem of hunger, right? I could help them get that sort of sandwich today, but it didn't do anything about their ongoing lack of food. And also about how my clients, they were not individuals, they were not exceptions. They were members of whole communities who were experiencing lack of nutritious food. So the really decent way to intervene, right, is to provide them sandwiches at the moment, right? People need food when they're hungry, but also how do we prevent those problems from happening again in the future? When we define a problem as individual, the solution is individual and more simple, of course. And when we define the problem as social or political, the solution is social or political. And many times the solution must be both. Right? And here are the human rights methods. This is about how we intervene with people. So, what participation we've heard about a little bit already, right? That means when we operate with our clients, we are not operating on them. We are working with them, right? It is a partnership. Clients are experts in their own situations. We behave in a non-discriminatory and anti-discriminatory way. We are very clear in our own work that people are not being excluded, and we make efforts to bring excluded people in. Capacity building. Capacity building is very important because it means that sometimes our clients do not have the skills they need to really participate in the kind of change that, would help them develop the skills they need to, change their unjust personal and political situations. And sometimes we can just be, oh, well, they don't have that capacity, we'll do it for them. That doesn't help, right? I mean, again, it might help in the moment, but maybe you work in the moment, but then capacity building approach helps people change a problem over time. Again, it's on that bridge between micro and macro. Strengths perspective is we look for the good in our clients. That helps us and them, right? We're not looking for what's wrong with people. We're looking for the ways that they have been resilient. Activism, activism is, really important. And it's certainly in the United States, in my NASW code of ethics, I am required to be activist, to change policy, to work for a more just world. Micro-macro integration, that I'm saying is so important to work on both levels. Accountability, right? That we're going to be certain. And, accountability also includes making sure that, clients know why you're doing what you're doing. It's not just that we're doing our professional work kind of in secret. We're really doing it in a way that everyone understands what's going on. And then this community and interdisciplinary collaboration. Social workers are superheroes, right? I'm a big fan of social workers. However, we don't have all the skills. So we really need to be collaborative in our approach to bring in other professionals and community members, right? I'm not a well digger. I'm not a community planner, right? I'm not even a chef. So I need all those people. So as I was saying, I've developed some of this work also to be a measurement project as well, as a conceptual model. I think it is, I use these in two ways. So we start with the first two, the human rights lens and the human rights methods scales. Those measure this model I've just been explaining to you. I like them both for use in kind of a pre-post idea where maybe I give those to students before a class, and then I see after we talk about this material, do they change the way that they see? Can I measure that change? The methods, similarly, especially with methods, that's a scales I often use in training with social workers in practice. I want to help them kind of assess their own use of the human rights methods and also think about how they might move forward. One of the other pieces that goes with that is I like to think about the human rights methods as, as a whole, as a complete, so that yes, we might do one or two or three of these, but really we need to do all of these. So when in training, how can I, push and encourage people to reach out and use more of these methods so that they can really understand themselves as human rights practitioners. My previous scales, and some of these have been translated and used in Taiwan, which is very exciting, are the human rights engagement and the human rights exposure scales. And again, those can be used as both pre and post for students in classrooms or with social workers in the field. And something that's been spectacular that I didn't realized when I began my work was that there would be such interest in it internationally, so that people would be translating and we would be able to begin to actually compare countries and social workers in different countries. And that is work that it's the beginning, and it's very exciting. It's been very interesting to see how social workers in Bosnia and Kosovo and Romania are interacting with the human rights methods. Really interesting. And I look forward to more as more of these projects come to completion. So in sum, what I hope that my work does in developing this conceptual model, measurable conceptual model for human rights practice in social work, is that it provides a simple definition for our field and a useful training for teaching, training, research, and practice, but also a challenge to social work education to promote a human rights approach that's larger than advocacy. That was one of my critiques as I began to learn about human rights and social work. But people were like, oh, well, you just advocate for that. That's your human rights. Well, it's, as I hope you've heard here, it's much more than that. And then, of course, there are the scales that help us evaluate our teaching and practice, to monitor implementation, and also to help us see how our own practice compares to those in other countries, other cities, other places. So I want to come back to the idea of activism, because here, the activism was the least endorsed of the rights-based methods in the United States, in Kosovo, in Bosnia, and Romania. And I think as we consider taking on an idea of a rights-based approach, rights-based work is political, right? We have to change the political structures that create and sustain inequality in our societies. If we don't do that, our neutrality, which sometimes people, I think, reframe falsely as professionalism, really that neutrality serves to ally professionals with the powerful against the interests of the underserved and the disenfranchised. You know, there's an opportunity here, and I hope that we will take that with COVID, to return to the activism that built our profession and revive our long, brave tradition of campaigning for civil, social, and economic rights. Right, and then this is just a story I tell my students, but I think it's helpful. Because as I say, we have to, this micro-macro piece is so important, I think, to the full picture of what is human rights practice. In my own school of social work, we sit right on a river. So I take my students down to the river at the beginning of class, and you know, we talk. I like to show them the river, especially new students coming into our program. And as I look out at the river, I imagine that I see a baby floating down the river by itself. And I say to my students, oh my goodness, what would we do if we saw that baby floating down the river? And of course they say, well, we would jump in and get it. So then I'm saying, okay, well, so now I have a student running into the river and the rest of us are watching, but suddenly we realize that the river is full of babies. So now all my students are rushing into the river and we're pulling out these babies, and some students are in the water and some students are patting them on their back and, you know, helping me, trying to revive these children. And then, you know, but one of my students has really strong imagination. Says, well, what are these babies doing in the river? We need to stop them. We need to get them. Whoever is putting these babies in the river, we have to stop them. So then if all the students leave the babies in the river and run to find out who's throwing them in, of course, then we'd have a terrible tragedy, right? So we don't want that. So maybe some of the students stay and keep pulling babies out of the river. Those are the social workers in direct practice, right? And then others run up and see that, you know, there's a monster on the bridge who's somehow throwing babies in the river, and they're able to put a net over that monster and, you know, no more babies in the river. It's a silly story, but it tells us social workers are required at both levels. And if we're really going to promote human rights, we have to operate at both levels. I think that Lilla Watson really speaks to what is human rights social work when she says, if you've come here to help me, you're wasting my time. But if you've come here because your liberation is bound up with mine, then we can work together. This is another inspirational slide I like to show my students, right? This is where if we are only working with the double mandate, if we're just thinking, okay, I'm going to work, I'm doing this thing for my clients, I'm doing this thing for my employer, we may not think creatively. We may not realize our triple mandate to really take a step back as professionals and reflect, is the work that we do really promoting human rights the best that we can? So I say to people, be the goat, break out of your, simple confines of your job and think about what would it look like if you were really promoting human rights and you were really living up to our values as a profession. And for your inspiration, I like to point out that social workers are human rights workers. We have two Nobel laureates, both Jane Addams from the US and Lima Bowie from Liberia have won the Nobel Peace Prize for their work. So again, I began with Arundhati Roy, and I will leave you with her. Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing. In my own mind, of course, I hear her whispering human rights and human rights practice to social workers. So I have also added just a selected bibliography here of my work in scales of translations, and a very selected bibliography of those who have interested and influenced me. Feel free to contact me. I look forward to engaging with you in person in March, and I appreciate you all very much. Thank you again for including me.